Let's bring him in, Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. Good morning, Dr. Joe. How are you?
Oh, I'm doing great until I just heard what you just said. I want so badly to switch with you today. Is there any possible chance that I could get out of work here and be going and sitting and watching a beautiful Guardians game and watching the kids run track? Oh, my gosh, Ray, have fun.
Hey, for you, I'll do my best to smuggle you in, my friend.
Thank you. You know what? I was thinking last night, and I always thinking of different things. And, oh, my gosh, I think in 25-plus years, I've never talked about these conditions I wanted to talk about today. Two different things, Ray, that I want to talk about. And they are head scratchers. I've had like 4 in the last week, and that's what makes me think of it. And parents and family really scratch their head when we tell them what the diagnosis is here. And to use a sports medicine term, we'll say they're from out of left field, these diagnoses. So 2 things I want to let your audience know a little bit about today, the best-informed audience in Ohio. I want to talk about one. There's an extra bone around the body in several different places, but the most common one is in the foot. And we see a lot of these kids who come in with foot pain and they're limping and they can't run and they think, oh my gosh, they think the worst. This is going to be something that, it needs surgery or crutches. They're going to be out a long time. And when we look, and I get a sense after 35 years of looking at these things, there's a bump on the inside of the foot, just above the arch and just below the ankle. And if you see this bump, and that's right where the pain is, there's a tendon that attaches there. There's an extra bone. We get an X-ray, and there's an extra bone there, and we have to use fancy medical words. It's called an accessory navicular bone. Accessory navicular is an extra bone. And, Ray, these things can be the size of pea size, marble size. My kid this week was a size of maybe a nickel, a pretty good size. I get quarter size, big extra bone on the inside of the foot. And when they play a lot of sport, these kids are usually flat foot kids. And the tendon that attaches is a big, strong one called the posterior tibialis. It pulls a lot on that bone. And like a lot of our other stress fractures or even growth plate fractures, it aches a lot. And you can just see in that one spot where that bump is, where that extra bone is, the pain they have. But here's the good news. The good news about these is they're easily treatable. And like many things I've told you in the past, oh my gosh, back in the day, people would see these, see how much pain they were in, and a lot of times there were surgeries on these things. And I'm here to tell you today, if you get an accessory navicular, an extra bone, you've got to try a course of physical therapy and primary care, non-operative treatment. Don't go straight to surgery. The vast, vast majority of these are in kids, and they get better without having to go to surgery. Much of the time we start with icing them. If they're so painful, we put them in a boot for a week or 10 days. We really get going on stretching and strengthening the muscles and doing some physical therapy treatments on them. And it's amazing. 10 days, 2 weeks, they're hopping on the foot. I've had dancers that were the lead in a big show coming up, or soccer players or lacrosse players, and they're just so amazed in 2 or 3 or 4 weeks with this extra bone, how much better they get. And then I got to remind them, you got to keep up keeping that muscle strong. They do respond really well to tape or an arch support because that holds that extra bone up a little bit and doesn't let it get pulled away from the rest of the ankle. And these accessory naviculars do very, very well without surgery in a short period of time. They're fun to treat, and I had a few this week. I wanted to get your audience up on that. I have one other one that I see a lot, and I had a couple this week also. By the way, the percentage of people that have the extra bone, the accessory navicular, everybody asks me that. About 10 to 15% of kids will have this extra bone, so they're not rare. And about 50% have it on the other side. So be aware of that extra bone on the inside of the foot. The other thing is, kids with knee pain particularly, we get an X-ray on them and we're looking for other things in the knee, and we often will see a cyst, a pretty pretty good size cysts sometimes. Sometimes they're smaller, sometimes they're big. A cyst-like growth that these kids see. And I have to say this 2 or 3 times to them, because when they see the X-ray, it looks ugly. And like the one yesterday, they can be large. And these cysts are non-aggressive, benign, non-cancerous growths that occur between the ages of 10 and 20. They don't cause pain, and the only time they're a problem is if they grow so big in the bone that they push the normal bone out of its normal place and thin the normal bone. We get kids who come in with a crack in their knee, and we take a look, and they could have a fracture through the cyst. So the cyst doesn't cause pain. We watch it for about 6 months. It starts to kind of resorb and shrink and go away on its own. But kids and parents are just totally, it's such a head scratcher when they look at the X-ray and they see this cyst in their kid's knee, and it kind of throws them for a loop. And I then repeat it again: benign, non-cancerous, non-aggressive tumor or cyst, and it's not going to cause them problems in the vast, vast majority of cases. So 2 head scratchers I wanted to touch on today to keep your audience on their toes that come out of left field that are fairly common in the pediatric population. Right?
Well, Joe, just to build on what you said when you mentioned extra and keeping us on our, quote, toes, little tidbit for you.
Yeah.
Do you know that Marilyn Monroe had an extra toe on her foot? She had 6 toes.
Oh, my gosh. We are born with a lot of variations of normal. Thankfully, we don't call them congenital abnormalities anymore because they're so common that we're born with a lot of these things. They're called variations of normal. And this extra bone in the foot, accessory navicular, is one of the most common, Ray. So don't get thrown if you're a parent or an athlete and you have this. Get in, get your treatments done. You'll be in good shape. You'll be back playing in a short period of time with appropriate treatment.
There you go. Joe, as always, my friend, good information. Appreciate the education, Joe. We'll talk to you next week.
All right. I'll be dreaming of you all day today, Ray. Have a great day.
Thank you. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. Indeed, Marilyn Monroe did have 6 toes.